A couple other associations. This is what we call VACTERL. VACTERL is a mnemonic. You don't have to have all of these associations to have VACTERL, but it's a handy mnemonic here. So the V is vertebral anomalies, such as a hemivertebra. The A stands for anal atresia, or imperforate anus. The C is for cardiac defects, such as VSDs, ASDs, any cardiac defect. The T and the E stand for TE fistula. The R stands for renal defects, so they can have horseshoe kidneys, for example. And the L is for limb defects, such as absent radius. So you don't have to have all of these findings to have VACTERL. You just have to have a couple of them, and you fit into that category. The vertebral anomalies, like I said, can cause a scoliosis, especially if it's in the neck. It can look like congenital torticollis. The other defects will have to be treated surgically, such as the heart defects and the TE fistula if they have them. Here you see a child with VACTERL, and these are the limb anomalies that can be seen. This child looks like, on the right, looks like a club foot. And here we have a limb anomalies of the upper limbs. And remember, with that association, limb anomalies, heart defects. So you should always be looking for those, and these babies deserve echocardiograms to look for heart defects. The charge association is like another mnemonic, and it's, again, non-random. It's not really a chromosomal problem, but we just see them and we lump them together. The C stands for coloboma. We've already shown colobomas of the iris, but they can be anywhere. The H is heart defects. Can be any heart defects, like a patent ductus, VSDs, ASDs. Atresia coani, that is choanal atresia. Typically, these are the babies that are blue when they're resting. They are pink when they start to cry. Why? Because babies are newborns are obligate nose breathers, and if you have a shelf there that prevents air from getting in, they're not breathing through their noses, they turn blue. When you stimulate the baby and he cries, he swallows air, and they pink up. So these babies, you need to secure an airway, and then you need surgery for the atresia. They also have the R, would stand for retardation of growth and development. The G is for genital hypoplasia or hypogonadism, and the E stands for ear defects or hearing losses. And they don't have to have all of these again together, but they do go hand in hand, and then you can make this association. Prune belly syndrome is basically congenital absence of the abdominal muscles. It is also associated with some other findings. It's a little more common in boys, so you'll see cryptorchidism with prune belly syndrome, and you also see genitourinary findings such as horseshoe kidneys or other renal anomalies. Since they don't have abdominal wall musculature, you can palpate everything in the belly. You can palpate the kidney, you can palpate the spleen and all. These patients also have a higher risk of constipation because you need those abdominal muscles to help move things along. Here's a patient with prune belly syndrome, congenital absence of the muscles of the abdomen, maybe complete or some partial. The ones that are partial, they can kind of bring them closer together. This is not diastasis of the rectus muscles like I showed earlier. You can kind of bring these together a little bit. Sometimes they need somewhat like a mesh to hold them together surgically, or they can wear externally like a girdle. That provides a little bit of tone. Poich-Jaeger syndrome goes along with these little markings that you see, these hypermelanotic areas that are seen on the oral mucosa. Poich-Jaeger is associated with multiple polyps and also clubbing of the fingers. These polyps, even though most of them are benign and there's a very low risk of them becoming malignant, there's so many of them that even with a low risk there can be some malignancy associated with them. So these patients will need routine endoscopies and removal of polyps. This is what's known as the leopard association. Again, this is just a non-random association, and it works out to be a nice mnemonic. Leopard, the L stands for lentiginous, which look like multiple nevi. They have EKG abnormalities like prolonged PR. They can have ocular hypertelorism, so what you see is the eyes are kind of wide-spaced. They can have pulmonary stenosis. They have abnormal genitalia, usually hypogonadism. They have retarded growth and deafness.